This is Mia with Sickle Cell Awareness 365. Jennifer is out this week, but she will be back on our next episode. Today, I have my warrior brother, Cory Lewis.
Hello, everybody.
Who is the founder of the Red Moon Project, and we'll talk a little bit more about that. But I wanted to bring Cory on because he has sickle cell, as I mentioned. He's a warrior brother, and he has had the COVID vaccine. So I want us to talk more about that because I know the whole COVID-19 situation, the virus and the vaccine, can be super scary, and a lot of us are hesitant. Our anxiety is through the roof because we just don't know. So I want to back up before we get to the vaccine. I want you to tell us a little bit more about you and how your childhood was with sickle cell, and let us know the type of sickle cell you have.
Well, my name is Cory Lewis. I have sickle cell SC, and I'm 27 years old, and I live here in Atlanta, Georgia.
Okay.
I also am a biology major, and I also work for the state of Georgia in the mental health, I guess you could say.
Okay.
And it has been my passion to really, push my nonprofit, and that's why I'm taking the steps to really find, experience in doing what I want to do and kind of take that and put that towards the nonprofit. So
Nice.
Kind of tackling a lot of things right now.
I get it.
Yeah.
Trust me, I get it.
Just a little bit, yeah.
So, and how was it as a kid growing up with sickle cell? What was your experience? Because all of us just have different experiences. So, how was it for you?
My anxiety is off the roof.
It's okay.
It's through the roof, and that's been my biggest thing too. But sickle cell has really affected me in my younger years growing up. Like my first pain crisis was at 6 years old, and I grew up in Tallahassee, Florida, so I am a country boy at heart.
Okay. Okay.
But Dr. Alfreda Blackshear was my doctor. If anyone knows, bless her soul, that is my favorite doctor in the world, and she taught me everything I needed to know about sickle cell as a child. And this was a black doctor who was so passionate about me and my health. And I feel like if I did not have Dr. Blackshear, I promise you, I don't think things would have went the way it. So I think that was the blessing part for me, to have a great doctor as a child. But my first pain crisis was 6 years old, and I couldn't walk, y'all. My knees sound like you don't want to hear them. They sound terrible, but that's what's really like hit me so hard as a child, is my legs, and it was just so hard to like walk around. My mom had to take me to the doctor carrying me. Even like 13, 14, she had to carry me to the doctor. So a lot of the times, it just really sucked that I couldn't do a lot of the things because of me not being able to mobilize.
Right.
And then, just growing up and having those words from Dr. Blackshear and learning that thing, learning those ways of taking care of yourself, I feel like that was the biggest thing that kind of pushed me to keep going. And, no matter what, if I can't do this, if I can't do that, sickle cell may put me in the hospital for a week, but I'm going to make sure I come back and I'm going to bounce back.
Yeah.
And that's like always been my passion, is like, don't let people tell you can't do nothing, because I always prove myself wrong.
Yeah.
And I'm here after working 8 hours. So yes,
And
I did it.
We definitely gonna get there, because I've had my time working 8 hours, going to school and doing and now even my plate is full, but somehow I manage it, so it's cool. So how was your transition? Did Dr. Blackshear kind of talk more? Did she assist you during your transition, like going into adult care? How was that process?
So this is where things turn, because I moved from Tallahassee, Florida to Springfield, Massachusetts. I moved from Tallahassee, Florida to Springfield, and that's where I was born. I was born in Springfield, Massachusetts, but my father, he died 3 months after I was born.
Wow.
So I don't even know what he sounds like. Like, I don't know, I know what he looks like.
Wow.
But we moved to Tallahassee, Florida with my grandparents, and I've been there ever since like 12, 13 years old.
Okay.
So once I transitioned into like my teen, we're moving to Massachusetts.
Yeah.
And I'm in Brockton, Massachusetts. And I remember our first month, I remember that week, we were snowed in for 3 days.
Wow.
So just imagine coming from, being in Florida where it's hot, and that was my biggest thing was the extreme heat, and that would put me on my butt. But now I'm coming to the cold weather, and now it's a whole nother, oh my goodness. So once I got to that cold weather, that's when things started to hit me.
I'm sure.
Am I saying pneumonia?
Pneumonia.
Okay. I hope please don't.
It's okay. It's okay.
Pneumonia, and then I had that for like 2 months. I was in the hospital for about 2 months at Boston Children's Medical. My mom, she stayed in Brockton at the time, so I was the oldest, so I had to, stay out there. I was on oxygen. I did not get a blood transfusion. And this is I don't know if other sickle cell patients can relate to this, but my family, they are Jehovah's Witnesses.
Okay.
And I think that changes the game
because
they don't believe in sharing blood, regardless of, you and your intermediate family. So no, I did not get any blood transfusions when I was in the hospital with pneumonia.
So how did they substitute that? Like, what was the process instead of getting the blood transfusion?
The biggest thing was my oxygen levels. Because I have SC, my sickle cell was not as severe, so thank God I did not need to really get a blood transfusion, but that's what the doctors were suggesting.
Okay.
And it was just to the point where my mom was like, no, she wasn't going to do it.
Yeah.
And that was probably the scariest moment for me because it was like, dang, like, is my mom?
Wow.
And then it's like, I knew at that time, I knew that was part of our religion, so I couldn't really feel no type of way because I grew up around this.
Yeah, that's Yeah.
So this is what I knew. So I didn't feel no type of way, but that's when I kind of knew that was my breaking point.
Okay.
I knew that was my point where I could really finally do what I have to do and not let sickle cell stop me.
Right.
Because I got out of that hospital, y'all.
Good.
Like,
that's a testimony. I feel like our whole life is a testimony. The things that we've been through, just in general, outside of sickle cell, is we've overcome a lot, and we still going. We still here.
Yeah.
So did your experience did that lead to lingering respiratory issues, or do you find that you need blood transfusions now in your adult life?
So now my adult life, I don't necessarily need blood transfusions. However, my sickle cell hits me in my vaso-occlusive area. So my kidney on this side is literally 5 centimeters. And this one over here is 11. And I don't know if other men have dealt with this, but I'm going to share this because this is something that I dealt with. Y'all, please don't judge me. And this is...
No judgment.
But when we found out what it was my sickle cell. And it's so crazy.
The priapism?
No. And that's what every man always talks about. But priapism for me has not been an issue.
Really?
What for me was my kidneys. Like, and that I think this started probably going into like 18, 17. That's when it started for me. I was literally urinating blood for like 3-4 days straight. And I promise you, we went to go test everything, and it was just like, what is this? What is this? Wow. I had to get a cystoscopy.
You had to get a what? Say that again?
Cystoscopy.
Cystoscopy, and what is that?
Basically taking a camera up your urethra.
Gotcha, that sounds painful.
Yeah, it was very painful. And we found out it was my sickle cell.
That's crazy.
And so... I feel like that's probably like the biggest thing is like it's really. I think that's the biggest thing. I'm sorry, I need to stop touching.
It's okay.
This is the biggest thing for me is like the older I get, these are the things that I'm hitting with my sickle cell.
Yeah.
So I don't know a lot of other guys who experience different things with sickle cell as they get older, but I'm not afraid to talk about it.
Good.
You know.
I think some of the reasons that it kind of is a silent or invisible disease as well as the symptoms is because people are afraid to talk about it. There's still shame surrounding having sickle cell and all that. So I get it, but it's good that you don't have any blood transfusions now or any respiratory issues. So that's really good. So, of course, we all know 2020 we hit a pandemic. We never lived in a pandemic before, not our generation.
Exactly.
And it's been super scary. The virus alone, like I said, it has been super scary. I kind of feel like everybody has the cooties now. That's what I call it. You know, when we were kids.
You ain't wrong for feeling like that. Look, I feel the same way.
It's everywhere. Everybody has it, and it's everywhere. Like, we can't escape the cooties, COVID-19. So when the pandemic broke out, because you said you're in school, you work for the state of Georgia, and you still promote your foundation, how did the pandemic affect what you were able to do as far as work, advocacy, and school?
I feel like the pandemic hit me in more of like the mental way. You know, I think a lot of people in their mental health kind of, you know, just having that thought of like, how am I going to do this? Or am I going to push through? You know, am I going to get sick? Is this going to stress me out and put me in the hospital? So a lot of the times I just felt like if I just continue to keep my mental space up, that is the only way I'm going to get through this. Yeah. And it's days, even coming here, I just had to literally like have that talk with myself. Like, Cory, you can do this. Yeah. You got to do this. You know, it's so much stuff you work for. You work for this. You did this. So it's like, why give it up?
Yeah. Yeah.
Why give it up? Yeah. And I think that was the hardest thing for me, is just really holding my mental capacity and not letting it take over.
I definitely think that was a huge, in a good way, it kind of let people share that more openly, because now I feel like we're all dealing with some type of mental health issue because of the pandemic. Yeah. A lot of us, probably before, you know, just life experiences can lead to serious mental health issues. But the pandemic, you know, some people lost their jobs. They're having to stay home 24/7 with their kids, their wife, sometimes, in some cases, stressful environments at home. Yeah. So I think it's been super stressful, like you said, and the mental health is like key to getting through anything, honestly.
That's very true.
Yeah.
That's very
just getting
true.
through life and dealing with sickle cell alone.
Oh my goodness.
So and the pandemic was just another layer on a grand scheme of things, because we can't escape it. So, but
I work for the state on a campus like full of, you know, adult mental health and forensics. So it was very I'm not gonna get into that yet. I'll wait. Okay. We'll keep.
Okay.
Because this is how some of the vaccines started.
Get into that.
Yeah.
Okay. So what made you get into the department that you're in? You said with forensics and.
So my cousin Nicole Alexander, she is a physical trainer. Athletic trainer. Okay. And you know what athletic trainer is, right?
Yeah, but explain for people who don't know.
Athletic trainers basically are the ones who are by the sidelines with the sports teams, basketball, football, and they're the ones bandaging, you know, up any wounds or any injuries, making sure the water is there. Very helpful to the team. And I grew up with her, you know, and watching my cousin play in the football team, and he actually was an NFL football player.
Nice.
So it was actually good to see, like, the physical part and me helping, and that's always pushed me to like want to help people. I think that's what gave me like that motivation to help people. But then when I got into being in the hospital weeks at a time, that's when I was getting all the help. And it was like, man, like I'm getting so much help from these nurses and these doctors. Yeah. So as I got older, that's always been my passion, is to like want to help folks and really just show them at the end of the day, it's not about me.
Right.
Because I know my future, my children, my generation, I want it for them.
Yeah.
And if I can take all the experience and have the fun of my life to doing it and helping other people, why not?
That's exactly how I feel. That's why I love the advocacy work. And, you know, we get into different aspects of the advocacy work, and I think it keeps us fresh, you know. Keeps our mind going on different ideas for our organization as well. Yeah. And getting around like-minded people just helps build you up. You know what I'm saying?
And not only that, I feel like that's what gravitated me towards Georgia Regional Hospital is where I work at.
Okay.
And it's just basically a psych hospital, and you treat these people with respect and dignity.
Yeah,
And
absolutely.
I think that was my easiest way of connecting with a lot of these people, because I did start respiratory care in Massachusetts, working with developmental disabilities, and working in respiratory care, helping other folks. So getting to the state level, it was kind of like, I actually feel like I can make a difference here.
Yeah.
And people respect me there.
Yeah.
And it's like, I've been there for 5 years now. Oh my God.
That's good though.
Oh yes, that is good. But at the same time, I feel like that's what really like made me work better with people, I should say.
Good.
I think that's the biggest thing. I understand people now.
Good. So what exactly is it that you do in helping people with your position?
So I used to be a tech on the floor. I got punched in the face so hard one time, y'all. It was ridiculous.
From a patient?
Oh yes. These are mental patients. So you literally are putting yourself at risk.
Yeah.
But how bad do you want to help this person? That's the question that a lot of techs have to ask themselves, and that's what I had to ask myself. And I was doing that for 2 years. And that's how bad I was like, we're gonna change. We're not gonna have this. You're not gonna be hitting me on this floor like this. But that's what I started off as a tech. So I was helping the patients, ADL skills, shower, eat, take their medications. And then after that, I left to go be a chiropractic assistant. And then I came back to work with forensic healthcare. Now, this is the real deal, because these folks are sentenced here. So they did some stuff.
Wow.
Yeah, so at this point I was more of scared, because I didn't know if this was going to like hurt me or help me. But it turned out so much different, because I treated these people like they were regular people, and they treated me so nicely.
And that's what they want.
That's it,
That's what they want.
So I changed my whole view of people in prison and all that, because honestly ain't nothing different from me. I mean, I made, just look, I'm just getting my words slipped up.
It's okay.
But, they did the things that they did basically because of what other folks have pushed them to do. And that's what I say, that mental capacity. So it's like I'm working around these people who have lost, they let that overcome themselves. Yeah. So what I look like working with the folks, and I'm letting the same thing happen to myself.
Yeah.
So that's my biggest thing, is like, I got to make sure I keep my mental health together so I can help you.
Yeah, absolutely. It has to be a priority.
Yeah.
Mental health, self-care, all that has to be a priority before going into anything. So I understand that.
Yeah.
You mentioned something with helping people. I let the question slip. But so let's get back to the vaccine.
Okay.
Were you able to, like, when you set the appointment, were you able to decide which location you wanted to go to, or if different locations had different vaccines, or what was the deciding factor to?
Georgia Regional basically was having like, a lot of different cases from the patients. And you got a lot of people coming off the street. So this is now coming to a point where everyone has to take precaution, because now the patients are getting sick, and we don't need the staff getting sick, because then the whole hospital won't go down.
Yeah.
So the doctor asked us, do we want the vaccine? I was skeptical, because hearing the stuff on TV and seeing different things, all over the place, I just was nervous. Yeah. I didn't think this was going to work out for me. And then I'm like, what if I have an allergic reaction or something? So I had to really think. But I only had 20 minutes.
Oh, wow.
Yeah, I had the 20 minutes to make the decision. So it was kind of like, well, do
That's
I say?
pressure.
Yeah, I didn't know what to say. So I'm like, Cory, just do it. And I called my mom before I did it. And she was like, I'm going to do it. Okay. Mom, we going down together. Come on. We going down together, but all right, that's fine. So I was like, that's cool. So I said yes. Come to work the next day. All right, your appointment's at 9. They did not tell us we were gonna have the vaccine the next day. Nobody was aware of this stuff. So I'm kind of scared, because I'm like, y'all, I ain't doing enough research. I'm scared. Yeah. So that's why I did the video, because I was like, I don't know who else is going through this, but I think I need to share this.
Yeah. And I kind of feel like at this point it's being forced. I understand why, we're being
Yes.
encouraged to take it, but it almost seems like we're being forced. I took my mom because both my mom and I were hesitant to take it, and she was able to get an appointment. I thought it was gonna be a couple weeks before they called back, but they called back like that next day and set the appointment for next week, and I was like, I'm not ready. It's
Yeah,
too
it's
soon.
so fast. It's like, dang, you trying to throw it in me like that?
Yes.
Like what?
And it's scary when you just looking at the grand scheme of things, and the historical mistrust
Yeah.
behind
Yes.
the medical care system and African Americans.
Right.
I do take all of that into consideration. However, I'm glad to know there are people that's out here trying to actually help us. You know what I'm
Yeah.
saying?
Yeah.
What part did your faith play in? Because you said you only had 20 minutes to decide.
Yes.
Was there a moment like, okay, what part did your faith play in the decision to get the vaccine?
Basically, it really was my mom.
Okay.
I feel like cause I told you about my dad. That's all that's my heart right there. So
Okay.
when she said she was gonna do it, I was, all right, mom,
Okay.
we're gonna make this step together,
Good.
and we did. So and everybody's fine. Nobody had no like crazy reaction, fatigue.
Yeah.
On
I've
oh
heard
yeah,
that a
when you
lot.
get that shot, you are going to feel so tired.
So after the first shot, or was it after the second one? Which one was it?
The
Both?
first one for me. Some people say they felt more tired after the second one for Moderna, but I felt more like just drained.
Drained. Okay.
And I felt like maybe that was I didn't even know this was an mRNA. There was no type of COVID-19 antibodies put in me, like from the Moderna
Good.
vaccine.
Okay.
If anyone didn't know that, and thank you, Sickle Cells, because I learned it from you.
So explain what the mRNA is.
The mRNA basically is kind of like our DNA. It's basically embedded in our DNA, so it's a lot easier to kind of fuse with your body, if that makes sense.
Okay.
So I think that people were very nervous from the COVID-19 antibodies or something like that being put into our body.
Gotcha.
But Moderna didn't do that. It was totally mRNA, so there was no type of COVID-19 antibody pushed in. However, it was just dark. The vial was just dark. I didn't like that. It was just
Why you
cloudy.
didn't like the fact that it was dark?
It was cloudy. I just wasn't. I never seen a vial like a vaccine like that. And I just was nervous when I did it. When I seen it, yeah, that scared me.
Yeah, and I think like the fear of everything just adds to the anxiety and everything else. My mom actually got the virus last summer, and she had mild symptoms. They didn't keep her in the hospital. She was just really fatigued from that. I don't think she said she was in any pain. It was just that drained feeling that she had. But she was just out of it. So luckily me and my niece tested negative at that same time. And like I said, both of us were hesitant. She finally got it, but the first shot that she got hasn't done anything. She's been fine.
Okay,
No
that's
drainage.
good.
She's still moving like she normally would. So that was good. But like I said, when they called her back for the appointment, I wasn't ready. So I took her to get it. And I could tell she was nervous then.
Yeah.
She was scared. Like the things that she do when she's stressed about something or nervous, she was really scared. Same as when she had the virus. So sometimes the fear gets to you more. It actually, fear minimizes compromises your immune system alone.
Oh yes, yes.
So when you add the fear on top of all these other things, you start to get physical symptoms. So I feel like in a lot of cases, the fear got to people more than the actual virus or even
And I agree. I think that's what happened with me. Is I was just listening to everybody else, and and not really taking the time to really just understand. Do I want to do this? Not what everybody else was talking about.
And you have to do. What did you find in your research about the vaccine?
There's like four ingredients. It's not a lot of stuff in there at all. Like
Okay.
I think that's what made me feel a little more comfortable because I knew it wasn't 50 million chemicals. I haven't found anybody dying from Moderna. Yes, they say people once they get the shot, this person passed away or something like that. But I still don't feel like that's the
What
case.
call?
I feel like a lot of times people really don't take care of themselves until stuff hit the fan.
Yeah.
And I've been in those predicaments, so that's
Yes.
why I'm saying that. Like, I really do believe that's what it is. But I feel like just having that knowledge of not seeing any type of deaths or and it's still short term,
Yeah.
you know. So I can't even go off of because it's only been 3 months.
Okay.
So you know, 6 months to a year, I feel like that's probably would be like, okay, you know what, boom, I'm good. But I do take care of myself, you guys. Like I've been working out more, I
Good.
eat better. So just taking those precautions and just making sure you know you're helping your body fight whatever the case may be. I think that helps.
Yeah, it most definitely helps. You know, we've talked about the supplements that you should take to boost the immune system, but we should, in a sense, should be doing that anyway, just to maintain our health.
That's true.
Period. So a lot of the things like working out and eating properly, of course, I feel like it aids because you're taking care of your overall health, and you know that's an issue. I won't even just say in the African American community, but it's an issue, period. Self care. And
Yeah, it is.
specifically in the black community, you know, we deal with food deserts, so we don't have real access to proper foods that we need
Yeah.
and things such as that. So it's a lot of things that play into the factor of us being where we are as a whole.
Yeah.
So it's we try to promote what we can.
And I think that's the biggest thing, you know, just trying to promote it and just making it accessible as well. And I think that's my biggest thing I want to do now is kind of like work on how can we bring this to the community. And I think that's the biggest reason why I also wanted to open up Red Moon to Black rare diseases.
Good.
I've been running into a lot of different black people with diseases I've never heard of. Like
Really?
absolutely never heard of. But I've connected with these people and it's just good to hear their side of the story of another rare disease and to hear like, wow, you really go through the same thing I go through and we both, you know, are the same ethnicity. So it definitely hits home and I feel like a lot of times with our black communities, we at this moment right now we're coming together.
Yeah.
And I think this is the best time to do it.
Yeah.
So I totally agree with that.
I think even though this whole virus and pandemic has been a mess in a lot of different ways, I've able to I've been able to pull a lot of good out of it. Just like the extra time at home with the families. You know, people like we mentioned earlier, some people live in stressful home environments, but if not, you know, that gives you time to develop that relationship with self first of all, with your faith and with your families and friends. You know, I think that time period and still should be used for self-reflection and seeing how you can make things a little bit better for you. You know what I'm saying?
Yeah.
And then we've had to adapt, you know, work from home now. Your kids are doing virtual learning. I know all that is stressful.
Oh my goodness, that's my school right there. Oh,
You're doing virtual learning?
it's like, this is terrible. That's online classes, man.
When I was younger, I did not like online classes at all. I wanted to be on campus.
Yes.
Now, I find it so, of course, convenient.
Of course,
I don't, and I love the fact that I was at Georgia State before, and they didn't have as many online classes, but now most of them are online. So I'm still with Georgia State, just doing online classes.
How many you a sophomore now?
I'm a senior.
Senior.
Yeah,
Okay, senior.
I came back to school as a senior. I only have, after this semester, I only have 5 more classes.
Congratulations.
Thank you.
I got 20 more credits left for school too. So
Okay, good.
I'm praying December walk across that stage.
We both gonna walk
But
across that stage.
that made me so happy when you said that.
Good.
When you said, well, that too, but when you said self-care, and I don't know if y'all saw me like slowly getting happy as you were talking, but when you said like self-care, like I think that is so important now, and I think the older I get, it's like, you know, I understand it more, but it's just, you know, I don't think people really think about it like that.
No.
So it's like, man, I just really want folks to understand you can take care of yourself and not need nobody's help. You can do it on your own. Like I'm telling you, and that's I just been making small steps from finances and optimal wellness.
Okay.
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 Optimal.
That sound like everything.
That okay. You got
everything.
it. See, I ain't even have to say all of that. Everything. You got to work on everything from finances and it's a work in progress for everybody. But I feel like the more I work on one by one, it's getting better.
And it starts to unfold, like it overflows into those other areas.
Yes.
I always break it down into financial, spiritual, physical, relationships. And that's just not intimate relationships. That's, our friendships, our family, all type of relationships. And I personally felt like I could be a better communicator with expressing myself. So that's something that I've been mindful about doing and working on with my family, friends. You know what I'm saying?
I'm working on it too.
Yeah, so it's always a work in progress.
That's why I say it's a work in progress for everybody. But if, you just take those steps and try to make them better, things will come to light and you will be like, oh, it's a breath of fresh air, know, regardless of the pain we got to deal with on a daily basis. People who don't see the sickle cell, they just looking at you like this, like, ain't nothing wrong with it.
Right.
That's fine. But at the end of the day, I know I'm doing what I have to do to be the better person and be a better man. So take them steps, y'all.
Right. Now, I've had a friend, because I think we do kind of get the side eye because we're kind of extreme with our precautions. I wear 2 masks, keep sanitizer. Everybody is not there, and I get everybody won't necessarily understand because they may not be going through what we've lived with.
Right.
So I had a friend who took, his sanitizer wipes to the restaurant where his family would be and wiped down the table and wiped out everything. And he told me his mom felt embarrassed because he was kind of overboard in her perspective. But it's frustrating when in a situation like that, when you're close people who know that you have sickle cell but still don't quite understand why you're going to these extremes and all that. So it's really unfortunate, but that opens the door for more communication.
It does. I feel like that is probably the biggest thing right there with the advocacy world right now is really trying to paint that picture for those other folks who can't see it. Because I work with a lot of folks, and I feel like they don't really care, and it's fine because I don't expect nobody to care. But at the same time, I need you to at least know because, if something was to happen,
You got to respect those boundaries.
Yeah,
That's another thing that the pandemic did. Okay, we're going to have to set some real boundaries because now we really have to be selfish in a way with our care. Like I said, everybody has COVID now. It's everywhere.
Yeah.
So we have to respect those boundaries. And I know I've had some issues with my family. We are used to being around each other all the time. Holidays are big. If someone's birthday or somebody's graduating, we just get together. So it's really been a disconnect, from the younger generation and how they feel to the older generation, and even me being, compromised part of it. So I have to get on my younger cousins. If you ain't wearing no mask, don't come near me.
Yes.
I might not get hugged today because I don't know where you've been still, you know what I'm saying? I kind of think the vaccine will lift a lot of that off, lift some of that anxiety off of me.
Can I tell you?
Go ahead.
I be coming out the car sometime and I be like, I have to put my mask back on.
Yeah.
Because that's just how I feel better now that I got the vaccine. I really do.
Yeah.
And it's like, I take the precaution at work because we have to. You can't walk around without a mask or a shield on your face. However, it's just like, I feel like, I don't know, I feel like I took a step and this is going to help me. And, and potentially it could help everyone else. So it's like, I just feel so much free. I feel more free.
I get it.
And now that this sun is out in Atlanta, it don't make it no better, so it does not make it any better.
That's what's also pushing me because I want that sense of freedom back. I want to be able to go out to these different places and not be scared that
Yeah.
I'll get COVID-19. It kind of imprisoned us in a way,
Oh my goodness, yes.
you know,
Yeah.
because we don't have those freedoms anymore. And especially being an immunocompromised, people who don't go through this, you know, they wear the mask, they have the sanitizer, but they still traveling, they still doing all these things. Traveling is one of the things that I'm itching to do because I haven't been anywhere.
Me too.
And
Whole
it's like,
year.
right,
It's like,
right.
man, who can sit in the house for 365?
Right. It's been rough.
That
It
is
has been
terrible.
rough.
I can't do that.
I've learned how important travel is
Yes.
for my self-care.
To get out, just to feel some sand somewhere else,
Something.
or feel just the air,
Yeah.
taste the air somewhere else.
Yeah.
You know?
So I really feel like, you know, getting the vaccine will open that door back up.
Right.
It was things that I was actually planning to do last summer. I usually plan my following years at the end of one year. So I was like, yeah, I had gotten my car. I'm gonna, you know, go to different vendor events and promote
Yes,
Sickle
yes.
Cell Awareness 365.
That's what I
Then
want
the pandemic hit, and I was like, how I'm gonna do this? I can't do
just
it.
like me. Cause that's exactly where I was. Like, it was going towards the summertime. I got back in March from DC. As soon as I got back, boom.
Yeah.
So it was like everything that I had planned, all the people I met in DC, it's done now. I can't do that. So that was a mental part. It's like, how do you deal with stuff like that after you plan so hard for something and then it's just taken away?
Yeah. Yeah.
It's like money's gone, time. It's like everything is just wasted. And
Exactly.
That'll mess somebody up.
Yeah, and everything can't be done virtually.
Nope.
It just can't, and it's a completely different vibe. I commend the organizations that have tried, and it's still been nice, you know, even though it's virtual. But it's something about being in person and just the vibe and the excitement of it all. It's completely different.
Even when you was like, oh well, you could just do the interview like
through Zoom.
And I was like,
Yeah. I'm glad you came in because I like to be here too.
Yeah, I don't want to do no Zoom meetings. I'm zoomed out.
Yeah. I like that. I'm zoomed out.
Yeah, I'm zoomed out.
So I'm glad and that's why I still come to the studio. Of course, for a while we were doing virtually because we didn't know what was what, and you know that's. When
you just take a precaution though.
Yeah. So I feel more comfortable now coming up here, and Jennifer does it from home, so it's just us three in the studio. So.
And I promise you, I ain't got the cooties. I got 2 hand sanitizers in my bag. Thank
you. Good.
Thank you.
So let's talk about this Red Moon project. So you talked about what encouraged it or what motivated it. What do you guys do?
So Red Moon has a long history, and I'm going to share this because I really haven't had like the opportunity to do it, but I always wanted to.
Okay.
Red Moon started when I was in high school. I was in 10th grade, 11th grade, and I started a little Facebook group. And it's on it's on Facebook too, so you can see like where it started. It started like in 2010.
Okay.
And I started with the Allen D. Sickle Cell Foundation.
Okay.
I don't know why I did that, but I've been changing the name several times. I've changed the logo several times.
Yeah.
And like over the years, I think once I hit 2019, that's when things kind of just got rough for me, and I really just had to find something to motivate me to keep going. Okay. Because I'm telling you, when you dealing with the sickle cell pains, and then this is when my kidney situation was happening, so I didn't know really what to do. I'm like, I got to figure something out, but I really wanted people to understand that this is serious. Yeah. So I was like, it's time to pull the trigger. Yeah. So I did. I went to San Diego to the Cayenne Wellness.
Yes, we was there.
There you go. We was there. That was my first like debut.
Good.
That was like the first time.
Oh snap!
Shaking the table.
Right.
That was like my debut. You know, coming out into the sickle cell advocacy community. I didn't know anybody. I didn't, you know, and I was just there like, hey.
And how did you like that experience?
That was a great experience because I learned a lot about sickle cell I didn't know.
Yeah.
I didn't know our ears can, you know, we can go deaf. I didn't know. That's why I have on glasses now.
Because of retinal issues?
Yes.
Yeah, me too.
And then, you know, I just didn't know all this could happen with just having sickle cell. So I learned a lot.
And my mom, that was her first time coming to, well, I won't say it's her first time, but it to a whole conference, that's her first time,
Yeah.
you know, being a part of something
She's
like
so
that.
sweet.
And she loved it. She learned a lot as well from someone with the trait. It was a lot, of course, at any of the conferences is a lot. So you have to sometimes pick and choose
Yeah,
you can
you
go
do.
to.
Because it was
But
3 days and it was all day. So there's no way you could intake that much information. Like that, it was a lot of information.
Yeah.
However, it I keep saying however, I'm sorry.
It's
I'm
okay.
in school mode.
It's all right. It's okay.
You know, when I just meeting you and spending time with you and Ashley and Dr. Rowley, like it just meet everybody. It really helped me fine tune what I wanted to do for Red Moon.
Good.
And that's when I knew like red represented something for me.
Good.
Restore,
Nice.
elevate, and develop. And that's always been my mantra for like the past 2 years is restore, elevate, and develop. And there's so much you can feed off of those because this restoring healthcare, you know, restoring communities, restoring just the quality of life in everyone.
Yeah.
And then not only that, just elevating our sickle cell warriors because we do have times when we're down. And there's times that, you know, we got to be checked on.
Yeah.
So I feel like that's important is to elevate what we can for our warriors. And then on top of it, developing awareness for everybody.
Yeah.
You know, we got to just put the awareness out there regardless because there's still things that's happening that we're not getting.
Right.
I mean, so if we don't say what we need, it won't happen.
Right. And we have to be vocal.
Yeah.
It's like we have to be vocal or we stuck in the same place.
Exactly.
And at some point you have to get tired of that current situation to and I think that's what motivates me to keep going as well because I'm sick of seeing certain things and it's like, okay, we got to change it. What can I do to change this?
I like that.
I'm tired of seeing it.
Yeah.
It just motivates you to change something.
I loved it.
So how do you balance work, your organization, and school? How do you balance it all? And sickle cell, because I know it comes in and it wants to turn up sometimes.
That's why I said, you see how I took a deep breath? Like,
yeah.
So, I don't have a choice in a way because I don't have family here in Atlanta. And I could move back home, you know. But at the same time, I've been here almost 7 years. I've made a name for myself here. So it's like I'm leaving everything that I've worked for. So right now it's like I have to continue to just stay focused. Sometimes telling people no hurts my feelings.
Yeah. I get it.
It hurt my feelings.
I get it.
But I have to just discipline myself because if I don't, I could slip up anywhere.
Yeah.
You know, so you got to pay for the car, you got to pay for the apartment, you got to make sure you keep the insurance. It's just everything is just piling up, and if you don't tend to it, you can't let yourself fall to shambles.
Yeah.
And I think that is so awesome that you do that with. Excuse me.
That's good.
My throat a little dry. I think it's amazing that you do the Ready Set Go.
Ready, set, transition, okay.
Ready, yes, because I think that's really helpful for a lot of young people transitioning and understanding medical insurance. That's why I'm working for the state. And the benefits is very helpful to me in my health. So the fact that I have to do that because I got shut down for Medicaid in Georgia.
See, right? Put them, tell it.
Georgia Medicaid, y'all ain't even right, okay?
Oh,
they shut me down.
Yeah.
They don't want you making no more 1,001. Like they don't want not even a penny. But who is surviving on $1,000 a month in?
It's really unfortunate, and that's something that I talk about in the transition workshop. You know, I want to give them that information because it can be helpful.
Yeah.
But at some point, especially as you're getting older, you like you said, you can't really live off $1,000 a month forever.
No.
You know, what we want to still be able to do things the average person can do, like travel, like maintain our own home, car, and just adulting, period, can be hard. So, and I've noticed this, you know, when I was working, I had insurance with Aetna or Humana, and now I have Medicare, and it's a huge difference.
And
I don't have. I want access to alternative,
the
treatments like
standards.
a consistent chiropractor, a consistent acupuncture doctor. I'm when I need to go to the primary care or to the hematologist, I do because I need to keep track of my overall health
Right.
in the sickle cell. However, I don't know. I just feel like that should be in the disease management or preventative care to keep me. I want them to pay for some of my massages because that's preventative care.
Yeah, I feel
So
like
you know.
so that was my issue when I had Medicaid when I first moved here in 2013. That's when I was getting like doctor's appointments and different things like that, but they was not covering certain specialty doctors. So I had to go downtown at Forsyth and go stand in that line and wait, and them people told me no. They was like, well, you deny. You can't give you no more money. So that's why I had to find different jobs, and I bounced from different jobs. So I went from a waiter to working with kids and behavioral health, and then that's when I found the state of Georgia from just working at different places because I was asking people around like I need the health care.
Yeah.
And that's crazy. They had to do all that.
Yeah.
But that's what I was doing. I wasn't working with jobs that was giving me the health care because Georgia did not want to give it to me unless I was not working.
Yeah.
And that's not gonna help.
I feel like in those instances when you're applying for assistance, they want you to just be really sick, like super sick, in the hospital consistently, and just not able to do anything. When in some cases we just need a little extra help. We can't always do the regular 9 to 5, 40 hours a week. And then even if we do that consistently, it wears on us physically. So it's like it's frustrating. But I went through the same thing as a young adult trying to get health care. Obamacare didn't exist then.
Right.
So
Wait, when was this?
I was about 2021. So this was 2003.
She don't look her age, just so y'all know. She don't look her age.
I'm 37 now. I'll be 38 in May.
Because I be forgetting. I'm like, how old is she? I know I don't look my age. Oh my goodness. I'm sorry.
So it's okay. But yeah, this was a while ago. And I was like, well, I want to work because that's just who I am.
Right.
Even now, I still get assistance, but I'm doing things like this. I'm putting my effort towards advocacy,
Yes.
I feel like I'd be more of an asset to the sickle cell community than where I was. Thank you.
You are
So,
a great asset to the community.
Thank you.
You are.
So, where can we find you in the Red Moon Project?
So now that everything is starting to release the walls in Atlanta, I will be at the Juneteenth Festival in Clayton County.
Nice.
Yes.
Okay.
So that'll be June 19th. So that will be like our official get it up. Hey, get it up. Hey, yeah.
Okay.
So you'll catch me there.
That will be like a vendor event, a parade, or
it's gonna be a huge vendor event. I think it's about 63 different vendors.
Nice. Okay.
So it's gonna be a lot of different people there. Food. I don't think there's a lot of health advocacies there. So I think it'll probably be me and maybe other person.
Okay.
But that's when I feel like everything will start to work out because I'm moving now and I just gotta really take care of home first.
Yeah, absolutely.
Yeah.
And tell us a little bit about these other advocacy organizations.
So this is exciting.
Okay.
So I've been networking. I think that's been also very helpful too when me talking to different advocacy groups, rare disease legislative advocacy group, RX and Reach with Dorothy Leon Glass.
Nice.
We got Georgia Bio with Maria Thacker.
Okay.
We got Global Genes, Global Advocates. Like there is so many projects that I have been like talking to with folks because I feel like now Georgia is we have the spotlight. I don't know if you know, but Georgia got the spotlight, especially on rare disease.
Okay.
So NORD is coming out with a Georgia advocacy project.
Okay.
and I will be going to them on the 30th to kind of see some things and see who all in the scene.
Yeah.
And I feel like this is gonna be our step to like getting our first bill in
Nice.
Georgia.
Nice.
So
That's exciting.
I'm excited, y'all. I'm
Yeah.
excited.
That's
I'm
exciting. That's
so yeah,
very exciting.
we're gonna make some changes, and
Good.
I definitely want to get more in tune with the Georgia Sickle Cell Comprehensive Center.
Okay.
Because I have not really been visiting them as much, but I think it's time for me to start volunteering at Grady.
Nice. That would be awesome, and they need the help as always.
Exactly,
so.
and I think that'll be a great way to kind of extend my help to the older sickle cell patients and see what they need, because they have needs too.
And you'll learn a lot from that. I remember it's been some years ago when I went down to the Comprehensive Sickle Cell Center, but there was a older gentleman. He was 83.
Oh wow.
He stepped in there with his suit on, his coat, his hat. You couldn't tell him nothing. That man stepped in there sharp as a tack. Okay,
Yeah, sickle cell.
Yes, at 83 years old.
That's kind of inspiring a little bit. Hey.
I love to hear stories of older sickle cell patients, because they defeat the odds. They are living past this age range that we
all think we got a stop to.
Yeah, so I love to see it when one of my older friends, she turned 64 not too recently. It's motivating to hear those stories. So yeah.
It is. So that's why I think I really do want to volunteer, because you got the young folks, and then they're always going to be intuitive and want to learn different things, but just hearing those older people, that's still inspiring to keep pushing their legacy and what they, their views on different things with sickle cell. So
absolutely.
It makes me happy.
Good. So we'll take a couple questions. 470-251-4647. Again, 470-251-4647. I do want to mention that if you missed the last episode of me sharing my weight loss journey, you can definitely tune in to Selfish Self-Care on Wednesday, March 24th at 6. A fellow warrior, she has this self-care podcast, in a sense, on Instagram Live every Wednesday, and she talks about different self-care methods. And like we mentioned earlier, that's something that we really need to take into consideration. So again, the pandemic kind of could have, if we allowed it to, let us sit back and reflect and change some things with our life, and changing ourselves in a sense as well. So
that's awesome.
Thank you.
Look, I'm all about self-care and prevent, and I've seen the VitaFlow.
The VitaFlow.
VitaFlow.
The vitamins?
Is that what it is? It's like you get the drip for the.
I don't know about this now.
I thought you did this.
It was another. There was a woman that came to the house. I can't think of her company name, but she did come to the house and just basically administered an IV. It was a drip.
Well, let me put you on game.
Okay.
Then. Okay, yeah. So VitaFlow, it is in Brookhaven and Buckhead. Bow Wow apparently is in this place all the time.
Okay.
But they are it's like a hydration station, and I was like, I think I want to do that. And I was like, I thought about you.
Yeah.
Because I thought you did it.
Well, yeah, it wasn't with them, but I have done it. And she was a mobile person, so she was able to come to me. And she also had different drips if you want like B12 in your drip.
And that's what they offer there.
Yep, they do it a lot for athletes.
Okay.
She had like an immune boosting drip, so it may be pretty much the same thing, but
I
would love to.
How did you feel with it though? Like, did you feel okay when you did it?
I did. I wish I had gotten it sooner. I'm stubborn, so like I guess I'll be in denial about the pain when I really feel it, and I try to go past it without taking the medications. But if I addressed it sooner, I think it would have helped more. But I even do that with I just don't like taking pain medication, so I do everything in my power not to take it to the extent.
I'm the same way, but you just it's like we've been taking it for years, so
I don't want to take it no more.
Yeah, I don't want to take that no more. We need to figure something else out. What else you got? What else you got? Give me something else. I'm just playing.
Yeah. So that's why I just try to find all these other things to incorporate to decrease the amount of pain medication I take. So,
well,
yeah.
VitaFlow is a great alternative, and then your homegirl who's mobile, because I probably would want the mobile one better.
Yeah,
but they do offer like hydration drips for, like you said, athletes and different patients. So I think if you do have that in your area, check it out.
Okay, and we're gonna hit them up for a sponsorship. Hello. So
okay.
So hopefully we can get some people in there, and hopefully that helps a lot of people. So thank you so much for sharing this information with us.
I appreciate being here. Honestly, this is nice.
Thank you.
I feel like I'm on a whole news station, y'all. This is awesome.
Silly. But yeah, it kind of is. We give that sickle cell news. So yes. I really want people to hear your story about the vaccine. I know we talked a little bit about everything. I told you, we catching up.
We are. Yeah, it's been so long since I seen Mia, everyone. So it's just good to see her face and just be in her presence. Seriously, because it was a really comforting feeling when I met you in San Diego and your mom. It was really good. So
nice.
It's awesome. And yes, everyone, I'm fine. I ain't got nothing wrong with me.
No extra body parts.
Nope.
No.
All my fingers is here. I'm good.
It's good. Good to know.
Do your research.
I definitely think, between you and the webinar that was about sickle cell and COVID earlier did take some of the relief off of me. So that helped a lot. So
that made me feel good.
Good.
Well, hopefully I was able to take the relief. Now it's time for me to go home.
Let's thank our sponsors.
Yo.
I want to thank Mr. Dan Moore and the Apex Museum. Please check out their website. They're not open right now, but hopefully when things open up again, we'll be able to access the Apex Museum. We love Mr. Moore and everything that he does. So we also want to thank Kids Stop Daycare and Learning Center with Miss Tanya Robinson. She's still helping the kids with some of them virtual learning, some of them going back, but she also, has the daycare within the after-school program. So she's still making it do what it do.
That's awesome.
And we want to thank the Black Professional Network. So, yeah, I will see y'all in a couple weeks, but I think we might have Cory back on for a future episode.
Call him. Okay, that's all you got to do. Just call me.
All right, y'all. Take care.
See y'all. Have a good night and eat good. Sleep well.
Right.
And stay healthy.
Stay healthy. That's it.